Hello, so I'm Stelu Grama, and I've been given the task of summing it all up and showing you how you could use IT to put it all together. So, based on what we've seen today, based on what you're probably thinking about appraisal and revalidation and all the questions that you have and all the information that you've already gathered, you probably know that the stakeholders, all of the people involved in this process will be nurses, appraisers, organisations and managers, all doing it for the sake of better patient care. And of course, at this point in time, especially since we're at the very beginning, you're thinking, okay, we're going to need a lot of things to get this process started, and we're going to need different things. Nurses, for example, will need an up-to-date portfolio in readiness for appraisal at this very moment, and of course in preparation for revalidation. They'll need easy access to their training. They'll need an easy appraisal process that is not a tick-box exercise, but it's not too much bureaucracy either. They will also need a tool to create and track personal development plans to make sure that they're always keeping up to date with their continued professional development. Then we've got appraisers, who will need easy access to appraisal documentation. So they don't just need to be presented on the day of the appraisal meeting, but a bunch of papers that they need to go through. That is not effective at all. They need a structured appraisal process that fits in very nicely with what the appraisees need to do. And they also need simple PDP setting and a straightforward tracking tool. Organisations and managers, whether they are primary care organisations, secondary care, private care homes, anything that you can think of, they will need reporting to know if staff are compliant and up to date. That is not just for appraisals, that is not just for revalidation, but to make sure that they're fully compliant at all times. They will need the ability to conduct effective and robust appraisals. Appraisals are the process that don't seem to be going away, so even if they won't be integrated into the revalidation process, you still need to have a very structured and effective process in place. They will need instant access to appraisal forms, and a simple auditing tool. So, what better way of putting it all together for better communication than to have one simple system that can actually bring all of these stakeholders together, that can ease the communication, the efficiency and the transparency of appraisals. But right now there are nurses who are just gathering their portfolios and having them somewhere under their desk. There are appraisers who don't really know when they're going to get that documentation. And there's the organisation who need to manage hundreds and thousands of members of staff, and they don't even know. Sometimes they lose track of who's done the appraisal and who hasn't, because it is a very, very time-costing process. So what we need, of course, for better communication is to create an online community, to create a very simple way of facilitating that communication and bringing all these people together, especially as a first step towards revalidation coming next year. And I'm saying this because from our experience with doctors, the trust and the organisations that have started earliest were the ones that were most successful and best prepared when revalidation actually came by. Because you do need a lot of time to train your staff on how to get used to any appraisal system that you might choose to use. You need time to see what the problems are going to be, what are the frequently asked questions, and how you're going to tackle them before the actual revalidation comes and brings an extra burden onto your whole procedure. So, surprisingly enough, we have created a system, which happens to be an IT system, that will actually do all of that for you, one way or another. It is called HeART, and is a healthcare e-portfolio for appraisal, revalidation and training. Of course, this is the example that I'm mostly familiar with, so I'm the one that I'm going to be using, but any system that can bring all of that together will be a good enough system to help you with this process. HeART will empower organisations to meet the needs of all of its stakeholders. It is aligned to national legislation, and it is future-proof. And I'm going to show you what that actually means. Because of course, we do know that we're at the start of 2014, and of course we don't know exactly how everything is going to pan out in the revalidation process, so we need a flexible enough tool that we can implement today to start having structured appraisals, but at the same time be ready for whatever decisions may come from the NMC. Key features of HeART. You've probably seen that picture before, and you have it over there on the panel. This is everything that HeART does. It's not just appraisal management, it's also CPD recording. It's an external training portal. It has your mandatory learning courses on there. You can put any of those elements, a bit like a pick and mix really. So we can do all of that, But you don't need to take it all in. You take what you need as an organisation, what you need as a nurse. And instead of keep showing you screenshots and keep going through PowerPoint presentation, I'm actually going to show you what a live system looks like and what you can do. So, first of all, I'm going to go onto a management dashboard. And I know there's been a question from Norma, I think, about who's going to manage all of these appraisals and who's actually going to be the equivalent of the RO. We don't really know at this point in time, do we? But what we do know is that someone will need to oversee this process, one way or another. And what we have for them is a management dashboard that can be structured in any way that you want it to be structured as an organisation or as a small GP practice. I don't know if it's zoomed in enough, but what we have on there is different types of healthcare professionals. So you can have nurses, you could have dentists, you can have AHPs, anything, any type of member of staff that you need to do an appraisal for can actually be put on this system. You can break down these different groups into specialties or departments or directorates, again, depending on your organisation. And at third level, you could even incorporate agenda for change to put the paper bands in there. That again will bring us to what Alison was saying earlier, that you could tie in appraisals with pay progression if that was the aim of your organisation. At this level, of course, you actually get into the people that you've got in that little group there, and you can access their appraisal information. So you simply click on View Details, and it will take you straight to the page where you can access different types of information. And this is, obviously by default, all of the elements that you could enable and that you could have access to. Again, you don't have to take them all. So that is the benefit of it. You have it all there, and you decide what you take, depending on what your needs are. You have a whole series of reports, and you get all the help that you need in order to use it as a manager or as head of appraisals, whatever this role might be called. Now, I've shown you that there are many different types of professionals that you can have on this system. But of course, they will all be working on different types of competencies, different frameworks. It might be that you need to allocate different training to them. So how are you going to manage that from one system? Well, again, you make one that is flexible enough and that can have any type of competency, regardless of of who those people are. So what you could do is you could select, by using those filters there, you could select what type of organisation role they have, what service they're in, what pay band they are, and actually allocate their competency. It could be the 6 Cs, it could be KSF, it could be adjunct dentist bandings, anything that you could possibly imagine, or anything that the NMC might come out with, you could actually allocate to them, and they'll have access to a whole series of evidence that they need to show in order to complete a successful appraisal. From here, what you would do, you wouldn't just allocate competencies. You wouldn't just look at a list of people's names and do your reporting. You can actually communicate with these people. So you can track and see if they've submitted their forms, for example. And if they haven't, then you can simply decide to send them an email from the system. So use this as a means of communication as well. And that, if I may use an example, that has worked very well. For doctors, that has worked very well. You keep it all in one place. You don't need to worry about Outlook distribution lists or anything like that, because you have it all in one system. You can create any report that you want, and you can send out any type of communication that you wish to do. As soon as you've allocated those competencies, as soon as you know who needs to show what type of evidence, as soon as you've allocated the training and all that, then you actually start focusing on the appraisal process. So the whole administration side of things is done by the system, really. There's lots of automated reminders, there's automatic tasks that come out. So you don't need to worry about tracking those things, because the system will tell you when someone's overdue. The system will tell you when someone hasn't sent their forms, or if they haven't even logged in and they're not engaging in the process. So you wouldn't even need to log in every day, because whenever something like that happens, you get an email. So it takes out a lot of the administration burden. Then at the front end, obviously for the people that are actually being appraised and in the future revalidated, this is what they'll get every single time they log in. You've seen this before in Lizzie's slides. And of course, as we're working with Lizzie and to create a system that was fit for purpose for North Central London, we're also getting lots of feedback from other different types of organisations, whether they're secondary care or private healthcare. And they say that, yes, they very much want this structured appraisal system in place, but they want it slightly different. So again, we said, you decide what you want to choose, we'll build one that is wide enough to incorporate everybody's needs, and then people just take and pick whatever it is they need. So we've created the same structured process for everybody, no matter what organisation you're in, no matter what your role is, service or pay band is, you get the same progress bar that you have to follow. So you can see all of those circles on there, tell you exactly what you need to do next in order to carry out a successful appraisal. So even if you're not very IT literate, even if all of this scares you and you think, oh, there's going to be a lot of work to be done on this IT system, no, it's not. All you need to do is go onto those circles, for example, evidence, action it as it's telling you to, and you'll just get through the appraisal process. And the beauty of it is that it does it all for you. So instead of stacking up your papers of evidence, just upload them onto there, and the system will sort them out and put them in an appraisal form for you. And actually, I'll show you how that works. So I'm going to put a test evidence item there, which, I don't know, could be this event. You can link as many documents as you want to it, and you can also link it to development needs that are sitting in your PDP. So again, you bring it all together. Whatever it is you decided at the previous appraisal meeting, you can actually show that you've achieved by adding it to this piece of evidence. And then again, there is your reflection. Reflection is very important, and on the system, you can either choose to keep it separate from your appraisal or actually show it. So whatever comes from the NMC consultation, whatever it is they decide to do with reflection, you have two options there. So you decide, at the very beginning, you decide how it's going to work, and then in the future, that will be done for you. At the bottom there's the button that actually makes it different for everybody. So the competencies that I've allocated a couple of minutes ago are now reflected in that button there. So I've chosen for this particular nurse the 6 C's as a competency framework. I go onto that button, and now I see the 6 C's, and I can link the evidence to that. If I'd chosen CareSec, if I'd chosen the RCN principles or any other framework, I would have had different competencies in there. So you can tick as many as you wish, save, and that's your evidence already saved. And that's all you need to do as the year goes by, as you've got access to your system, and you start building your portfolio of evidence. And as you can see, this is sorting it out for you based on the competency that you need to show. So if I was to expand those, so you've already allocated them to the correct categories, and you'll keep building your portfolio like that. So even if you only need to show an up-to-date portfolio as a nurse, you see you've got the access to portfolio. If you need to use this system for appraisals, you've got the appraisals element there as well. If you're only going to be required to do training on the system, you've got it there with a list of statutory mandatory training and any e-learning modules that the organisation might have chosen for you. So it's all there for you to use. Now, in terms of the appraisals and how it actually gets automated, you've got your forms that get created for you based on the information that you've already entered on the system. So you'll have all of your general details in there, and then below here you've got your evidence, again structured on the competency framework that you were initially were allocated. You can see I've added already all of that evidence. So the system does all of the sorting for you. All you need to do is add your reflection in the 3 boxes, sign it off, and it gets sent straight away to your appraiser. The appraiser gets an email and gets access to your appraisal form straight away. As soon as the appraisal is done, that all gets archived in the appraisals tab, and it becomes available to whoever's going to supervise all of this process, whether it's head of appraisals, whether it's the equivalent of the RO, anyone that might come further down the line. With this whole progress bar, as soon as you've clicked and actioned all the circles, will come up with a full line of green circles and tell you that yes, you've successfully done an appraisal this year. Also, on the home page, you get to see who your appraiser is, who your head of appraisal is. You get automated tasks, so you always remember exactly what it is that you need to do next. You have an overview of all your dates. So basically, everything that you will ever need to know is there on your home page, and it makes it very, very clear for you. You wouldn't even need to go at the top here to actually go into all of the details of what the system can do. All you need to do is just follow the progress button. I'm not going to go into any more detail, and I'm not going to show you the appraiser's side. They've got access to forms instantly, they get their own tasks, and they know exactly what they need to do step by step. They've got a clear way of setting out the PDP, and that's probably worth showing. They've got a clear way, they just add the development needs one by one, and then they'll be able to mark them as achieved, or ongoing, or just delete them if they're no longer relevant. So it creates all of these steps in the process. It can be very easily followed for the sake of efficient appraisals. And now, for the live system, back onto the presentation, summing it all up, hopefully, from what I've shown you on the system, even if I didn't go into too much detail, we're able to see the key benefits of having an IT system in place. And I'm pretty sure that people in here that are using the system for doctors will be able to tell you that it has helped them, and that it is indeed easy to use. It is tried and tested, so it's already started being used by nurses. And from Liz's story, you could see that it is actually working. It brings effortless communication between stakeholders. You no longer have to worry about who's actually going to contact the appraisee for the form, and who's going to contact the appraiser to sign off. You get step-by-step guidance throughout the appraisal process. I haven't even touched on all the help that you can actually put on the system to make it very easy for appraisees and appraisers alike. You have the setup flexibility, so hopefully if you choose a system as flexible as HeART, you'll have something that you can configure as you wish, and something that you know will never get outdated because it keeps getting updated. And of course, there will be huge time and cost savings. It will take away the administration burden, and take away all of the time that you spend filling out forms and doing, what it is now, a tick box exercise. And again, there are key benefits for the different types of professionals. So these ones are a bit more specific. Nurses, midwives, all healthcare professionals will be able to maintain an always ready portfolio. There's no more paper, not bits of evidence that get lost. They can complete the statutory and mandatory training, they can create and track personal development plans, and ultimately spend more time with patients because they're no longer wasting time trying to gather all of the evidence required. Supervisors and appraisers will have an improved knowledge of the appraisal process because they get told what they need to do at every step, so they can't actually go wrong. They can conduct more effective, standardised appraisals. Every single appraisal has to follow the same steps. They can manage training, personal development plans, and appraisals all in one place. And lastly, for directors of nursing, commissioners, organisations, there are immense benefits because they'll be able to demonstrate compliance with statutory requirements. They can provide assurance to governing bodies, improve efficiency of appraisal and training, and they can start doing that straight away by putting a robust appraisal system in place. They can create cohesion between different staff groups. As you can see on the dashboard, you can have many different types of groups. You can increase the performance of workforce and ensure that the right staff with the right skills are in the right place at all times.